Hi, this is Cardio, and today we're going to be going over some conditions that affect the cardiovascular system. All right, let's go over this 4-quadrant chart that shows you the different relationships between different flows and different pressures. Over here, starting in the first quadrant, this arguably might be the most relevant quadrant for us. It's going to show the CVP and the cardiac output. You can see that there's an equilibrium point where the Starling curve meets the that relationship, and this equilibrium increases with exercise. So the purpose of this first quadrant is to show us venous return, which is this slope. Over in the second quadrant, this slope is 1 over resistance, where resistance is the pressure over the flow. Keep in mind that mean arterial pressure is proportional to flow, where MAP equals cardiac output times total peripheral resistance. In the third quadrant, the slope here is our arterial compliance. And in the fourth quadrant, the slope is the venous compliance. The CVP is the pressure in the vena cava, or the pressure in the right atrium. And the mean systemic pressure is the pressure in the vasculature when cardiac output and venous return both equal 0. The slopes can change due to the autonomic nervous system, so keep in mind those alpha receptors acting on our arteries. Over here is kind of a zoomed in version of that first quadrant. So you can see that with sympathetic stimulation in green, the contractility goes up, so that the CVP goes down at that equilibrium point. With normal heart, that's purple. And then in heart failure in blue, the contractility goes down, so the cardiac output also goes down, and the CVP increases at that equilibrium because the heart cannot pump blood into the arterial side as well. In a case of transfusion, before the reflexes kind of kick in to balance everything out, the CVP increases, so therefore the cardiac output must also increase. Let's look at the case of a hemorrhage. During hemorrhage, the pressure in the capillaries goes down, so by Starling's law, fluid is absorbed into those capillaries. So we start off at 0, where and then the first step in the hemorrhage, when you start losing blood, the initial volume goes down. There's not yet a change in slope, so that takes us over to 1. And then from 1 to 2, the baroreceptors increase contractility. They're telling the heart to increase cardiac output and decrease CVP, so that takes us over to 2. And then from 2 to 3, the venous compliance decreases. As CVP goes down, the cardiac output goes back to around 5 liters per minute. So we start off with a cardiac output close to where we end with, but in this case, the CVP is lower than where we started. In cases of exercise, the preload goes up and contractility goes down, and the afterload goes down, the TPR goes down. Keep in mind that the TPR goes down with increased work. The stroke volume goes up, the cardiac output goes up, TPR goes down again, and then the venous compliance goes down. This is a PV loop in the case of exercise, to see how there's more volume being pumped, and then the pressures also change a little bit more. The ESV goes down, contractility goes up, the EDV goes up as venous return goes up, so ultimately your ejection fraction is going to go up. For athletes in the long term, the stroke volume goes up by about 40% or up to 40%. The cardiac output goes up, the heart rate during exercise stays around the same, but the resting heart rates go down quite significantly. And then there are arterial compliance goes up and capillary density goes up, as they have that increased oxygen need. In cases of blood doping, EPA, or erythropoietin, the hormone increases RBC production, red blood cell production, so your hemoglobin is going to go up, and then your milliliters of O2 per liter of blood are also going to go up. You have 1.34 milliliters of O2 per gram of hemoglobin at 100% saturation. Pregnant people also undergo significant changes throughout the course of pregnancy. So the mean arterial pressure stays the same, but the baroreceptor gain goes up, so that it's more sensitive to disturbances. You can see here that the cardiac output goes up by about 40%, stroke volume goes up by between 20 and 35%. I saw conflicting information there. The heart rate goes up by about 10%. Diastolic and systolic blood pressure both go up by about 5%. Notice that these dip throughout the pregnancy towards the middle of the pregnancy, then towards the end they rise again. And then the TPR goes down by about 30%. Blood flow to the uterus increases about tenfold throughout the course of pregnancy. Plasma volume goes up by about 50%, and blood volume, as well as red blood cell count, also go up. Yet the hematocrit goes down because blood loses osmolarity. In cases of pheochromocytoma, this is a tumor on the adrenal medulla that causes an excessive release of epinephrine and norepinephrine. Some symptoms include a really high heart rate, up to 110 BPM. Blood pressure also shoots through the roof, 200 over 110, cold hands and feet, so poor circulation to the extremities, and then feeling hot. And then in cases of heart transplant, it's also just good information to have that the nerve stimulation is not connected when they transplant the heart. They focus more on the vasculature. So the beta receptors might not behave in similar ways because they're not being stimulated directly by the sympathetic nervous system. I hope this was helpful. Thanks for watching.